Let us come to the another film. This film is a straight X-ray of lumbosacral spine in lateral view. This is anterior side, this is posterior side. This is upper side, this is lower side. Here you can see the sacrum, sacral curvature. So this is the fifth lumbar vertebra, fifth, fourth, third, second and first. And this is 12th thoracic, 11th thoracic like this. So we can count the vertebra. Then how many vertebra are there in the lumbar region? All of us know. In the lumbar region we will get 5 lumbar vertebra. Total 33 vertebra are there. 7 is cervical, 12 thoracic, 5 lumbar, 5 sacral, which are fused to form a single piece of sacrum, and 4th coccygeal vertebra fused to form single piece of coccyx. Here all vertebral body, and in between the body we can see this space which is radiolucent, this one. This radiolucent area means this is the intervertebral disc. Intervertebral disc is a substance which is formed by 2 important components. What are these components? Centrally, nucleus pulposus, which is ectodermal in development and a remnant of notochord, and peripherally we can see the annulus fibrosus, which is composed of collagenous tissue and fibrocartilage, and it is mesodermal. So nucleus pulposus in the center is ectodermal and annulus fibrosus at the periphery is mesodermal. In the vertebral column, which is consisting of the series of all vertebra and the intervertebral disc, how much of the vertebral column is contributed by the intervertebral disc? And the answer is, it is about 1/4 to 1/5 of the total length of the vertebral column is contributed by the intervertebral disc. And here you can see the curvature. In this curvature, this is convex anteriorly. So the lumbar vertebra here, they are convex anteriorly. Similarly, the sacrum, it is concave anteriorly. If you go to the thoracic region, there you will get the again concave anteriorly, and the cervical region, they are again convex anteriorly. So convexity of the column you will get in the 2 regions. One is the cervical region and the lumbar region, and both this convexity or curvature, they appear after birth. So they are compensatory curvature or called secondary curvatures. But other 2 curvatures in the thoracic region and sacral region, it is concave forwards, and this concavity, they appear before birth or in the intrauterine life. So they are called primary curvatures. So 2 primary curvature, one is thoracic, one is pelvic, and 2 secondary curvature which appear after birth, and they are also called the compensatory curvature, and these are cervical and lumbar. When this curvature or lumbar curvature appear, it appears after birth, but when it develops at about 1 to 1.5 years of age, when the child tries to start walking, you should remember that the forward convexity of the lumbar curvature, it is due to the greater thickness of the anterior part of the intervertebral disc, not due to the thickness of the vertebral body. And the lumbar curvature, this one, they extend from the 12th thoracic to 5th lumbar vertebra. So this is the 5th lumbar vertebra, 5th, 4th, 3rd, 2, 1, and this 12. So the curvature starts from the 12th thoracic to the 5th lumbar vertebra. We can see this is the body, and you all know a vertebra having main 2 parts, one is the body, one is the vertebral arch, and in between these 2 is the vertebral foramen. And in the vertebral arch, there are pedicle, then lamina, then transverse process, then spine, then articular process. Here we can see in this film, this is the body, the transverse process, and this is the spine, we can see. But the pedicle and lamina, we cannot see properly because of superimposition. Here you can see, this is the pedicle, this one, going backwards, and this is spine. So all these are spine or spinal process of the vertebra. And this revolution area in between this pedicle is called the intervertebral foramen. All these are intervertebral foramen. The structures passing through the intervertebral foramen are the corresponding spinal nerves. Suppose this is fourth intervertebral foramen in the lumbar region. So the fourth lumbar nerve will pass through this foramen. Then what do you mean by the lumbarization of sacral vertebra or sacralization of lumbar vertebra? Lumbarization of sacral vertebra means the first sacral vertebra, this one, it is fused with the fifth lumbar vertebra. Then number of lumbar vertebra becomes 6 and number of sacral vertebra becomes 4. Then another term is there, sacralization of lumbar vertebra. In that case, the fifth lumbar vertebra, they become the part of the sacrum. In this case, the sacrum consisting of 6 vertebra and lumbar vertebra becomes 4. So these two conditions, you remember, one is lumbarization of sacral vertebra, one is sacralization of lumbar vertebra. And another terms are also very much popular. One is scoliosis, kyphosis and lordosis. Scoliosis means it is the lateral curvature of the vertebral column, and the lateral curvature of the vertebral column is well visualized in the anteroposterior view, not in the lateral view. And what is kyphosis? It is the increased posterior convexity of the thoracic vertebra. Posteriorly is more convex. That is called kyphosis. And lordosis means already the lumbar vertebra, their lumbar vertebral column, it is convex anteriorly. But if this convexity is increased, it is called the lumbar lordosis or lordosis. And another term we find in the clinical side, that is called spondylosis, and one is spondylolisthesis. What is spondylosis? Spondylosis means it is the degenerative condition involving the intervertebral disc, and in the X-ray film we can see the leaping of the vertebra here, and they are called the osteophytes. So osteophytes are formed due to degeneration of the intervertebral disc, and it is called spondylosis. And another term is there, spondylolisthesis. In this condition, the fifth lumbar vertebra along with the whole vertebral column slips forward over the first sacral vertebra. So this fifth lumbar vertebra and its column slips forward. That is called spondylolisthesis. And the term that is called the disc prolapse. Disc means intervertebral disc here. The disc may prolapse posteriorly or posterolaterally. If this prolapse occurs straight posteriorly, that will compress the spinal cord, or if the prolapse occurs posterolaterally, like this posterolaterally, it will affect the spinal nerve roots. So the prolapse and its effect depend on the direction of the prolapse, either posteriorly to spinal cord, posterolateral to the spinal nerves roots. Which disc is commonly involved? It is usually between the L5 and S1. This one here, commonest sites, followed by L4 and L5. These two areas are the commonly affected site of disc prolapse. And other areas we can see, they are all the gas shadows. Here all these translucent areas or radiolucent areas are gas shadow, and here is the anterior surface of the sacrum, concave forward, and there is some other shadow for the viscera which are less dense. They are all the visceral shadow, and these are all gas shadow. So that's all for the lateral view of the lumbosacral spine. Thank you very much.